Hi, I'm Jeremy, and this is my life. Whether it be online or even at school, I just don't seem to fit in.
Teen suicide. Thousands of teens commit suicide each year in the United States. Suicide is the third leading cause of death for 15 to 24-year-olds. Studies show that at least 90% of teens who kill themselves have some type of mental health problem, such as depression, anxiety, drug or alcohol abuse, or a behavioral problem. May also have problems in school, with friends or families, or a combination of all three. Suicides that include a firearm, 45%. Suicides that include suffocation, 40%. Suicide that include poisoning, 8%. Why do most teens commit suicide? Most teens who commit suicide most likely have a mood disorder like bipolar disorder or depression. A mood disorder is an illness of the brain. It can come on suddenly or be present on and off for most of a teen's life. A teen with a mood disorder may be in one mood for weeks or months, or may flip from one feeling to another. Teens with bipolar disorder, also called manic depression, may change between mania, anger, and very happy, depression, sad, or very crabby, and euthymia, normal mood. Some teens have more mania, some have more depression, and some seem normal most of the time. Mania and depression can happen at the same time. This is called a mixed stage. Teens in a manic or a mixed stage may strongly overreact when things do not go their way, become hyper agitated or aggressive, sleep less, feel they can do things they really can't, spend money they do not have or give things away, act in impulsive or dangerous ways.
Anxiety is the uneasy or apprehensive feeling we have when we're facing a stressful or uncertain situation. Teenagers are particularly prone to anxiety. Some common triggers for teen anxiety include relationships with family and friends, peer pressure, and striving for good grades. Body image and a changing body can also cause anxiety. Mood disorders are most likely to be experienced by children with ADHD, which include dysmetic disorder, major depressive disorder, MDD, and bipolar disorder. Dysmetic disorder can be characterized as a chronic low-grade depression. Major depressive disorder is a more extreme form of depression that can occur in children with ADHD and even more frequently among adults with ADHD. Dysmetic disorder and MDD typically develop several years after a child is diagnosed with ADHD, and if left untreated, it may worsen over time. Bipolar is a severe mood disorder that has only been recently recognized as occurring in children. Unlike adults who experience distinct periods of elation and significant depression, children with bipolar disorder present a more complex disturbance of extreme emotional instability, behavioral difficulties, and social problems.
Teens with depression may feel sad, down, or not feel like doing things, feel guilty, worthless, or hopeless, have a change in sleeping or eating habits, lose interest in things they used to enjoy, feel lonely, get easily upset, or talk about wanting to die, have less energy, or have more difficulties paying attention. What are the most common warning signs? Trouble in romantic relationship, difficulties getting along with others, withdrawal from friends and family members, drug or alcohol abuse, talk about suicide even in a joking way, having a history of previous suicide attempts, reckless behavior, dramatic personality change, running away from home.
Where the hell have you been?
It's none of your business.
None of my business? It isn't my business.
Right, it isn't.
Maybe you'd rather be with your whore.
Don't you dare call her that.
You admit it, you unbelievable bastard.
That is it. I'm gonna shut you up once and for all.
You put that
Get
down.
your hands off me. Get out.
Effects of teen suicide on family members. Adolescence is a time of many changes and challenges. Developing body and social and academic stresses make for a difficult period for many teens. Yet most teens get through these years with only a short-term feeling of sadness. What people sometimes use the word depressed to describe how they feel. This is also known as clinical depression. The wave of shock and grief that results from a loved one's suicide forever changes his family, friends, and community. No one ever expects it to happen, and it always is a tragedy whenever it happens. In fact, 5,000 American teenagers commit suicide every year, according to the National Suicide Help Center. 3 times as many attempt it. In the survey of high school students conducted by the American Association of Pediatrics, 60% say that they had a thought about killing themselves, and 9% said they had tried it at least once. The teen years are characterized by extreme stress, confusion, self-doubt, and pressure to succeed, says suicide counselor Dr. Thomas Burton. These issues are frequently compounded by divorce, substance abuse, major recollection, and a number of factors relating to the stress of modern life. Many teens will have a difficult time coping with changes that accompany growing up seeing suicide as a way out. Disturbingly, the teen suicide rate has risen an astonishing 20% in the last 40 years. Today, suicide is the 3rd leading cause of death among 15 to 24-year-olds. After auto accidents and homicides, Dr. Burton attributes the dramatic rise to current increase in divorce rates, teen drug abuse, the easy ability of guns, and increased economic pressure. It's worth noting that teen suicides are twice as high with white males as among the male minority of females. And firearms are far and above the most common weapon of choice. Statistics say also indicate that teen suicide rates in rural areas and in mountain states of Colorado, Wyoming, Utah, and Montana are considerably higher than in the rest of the country. Seeing the sides. David, who was a well-seen, well-adjusted teen, outstanding athletic, and high academic achiever, caught his family and classmates off guard with the decision to end his life, but many teens will attempt to take their own lives to show early warning signs. Everyone exhibits regular mood swings, but if a teen disposition lingers for more than 2 weeks, serious depression could be setting in, says Dr. Burton. If there's a cause for concern, parents should monitor their child's mood swings and talk to them frequently if they feel concerned. The other side, Dr. Burton encouraged parents to watch for frequent naps, excessive sleep, drug, alcohol abuse, and an obsession with death, poems, music, drawings, jokes about suicide, history of suicide in the family, traumatic experience such as pregnancy or relationship problems, suddenly giving away prized possessions. Dr. Burton emphasized that there are numbers of things a parent can do if they believe their child is considering suicide. Aside from seeking immediate counseling, parents should also remove all dangerous weapons from the household, including knives, sleeping pills, ropes, and especially guns. When dealing with the potential suicide victim, experts unanimously agreed that good and immediate communication is essential. Parents should remind their distressed teen that no matter how awful his or her problems seem, it will work out and that they are willing to help. Dr. Burton says, ask them to talk about their feelings, listen carefully, do not dismiss their problems or get angry. If the early warning signs are there, suicide is certainly preventable, but it is very important that adults respond quickly with high level of patience. According to a study, 90% of suicide teens say that no one in their families understood them or listened to their cries for help. It is also important that parents take time to listen and help their children understand that life is not as bad as sometimes it appears.
Hey Ma, I'm home.
Long day?
Very long day.
Father Tim. I'll take wheelchair Scott.
What? He's in a wheelchair!
There are 7 different kinds of depression, and each of them have different symptoms. One type of depression that one may encounter in a person's lifetime is major depressive disorder or major depression. This person will start to have problems functioning normally. The person's ability to work, sleep, study, eat, and enjoy activities will be interfered with by their depression. Having major depression disables a person from doing regular day-to-day activities. The symptoms should occur daily for at least 2 weeks. A person with major depression may experience a single episode, but some also experience multiple episodes with depression. Now, if a person has long-term symptoms of about 2 years or longer, then they would be diagnosed with dysthymia or chronic depression. Dysthymia can prevent a person from feeling well and may also prevent some normal functioning. Although the symptoms may seem similar to major depression, it is not as severe. With chronic depression, the person may also experience 1 or more episodes. There is also minor depression, which is more mild. It includes symptoms that last for about 2 weeks but don't go as far as having the symptoms for major depression. Some of the symptoms for minor depression may be excessive sleeping, overeating, and/or extreme sensitivity to rejection. Psychotic depression occurs when a person has severe depression and some form of psychosis. This can be the person having a break from reality or experiencing hallucinations. Postpartum depression is something that about 10 to 15% of women experience after giving birth. The hormonal, physical changes and new responsibilities get extremely overwhelming. The mother will experience major depression within 1 month after the delivery, and if it is not treated, it can become very dangerous for the mother as well as the newborn baby. There's also seasonal affective disorder, which has symptoms of depression that occur each year during autumn and winter. Now, during the spring and summer, the depression will end. Lastly, there is bipolar depression, also known as manic depression. Bipolar depression has symptoms of constant mood changes from extreme highs to extreme lows.
Causes to depression are numerous depending on situations at home or past experiences. If an adolescent is being bullied at school, then it is common for that student to shut down completely. Friends and family begin to notice how he or she is starting to withdraw from society. They are distant, moody, and tired. Stress takes a toll on the youth as well. School, work, and responsibilities are the factors that add on to this worry. Fatigue is just one of the symptoms to depression. The young adult is emotionally and physically worn, living day by day with little to no motivation. They seclude themselves, hide in their rooms, or avoid contact with other people. This exhaustion leads to feeling hopeless. Why do I even try anymore? Is there any hope for me at all? Memory loss is another symptom that occurs with lack of concentration. Their minds are cluttered with unwanted thoughts. ones that distract that person from doing simple tasks. They experience headaches and even stomach pains. Stress also causes these medical issues. When combined, you get a struggling teen whose sanity begins to slip. They rather die than hurt. They also lose interest in activities that were once enjoyed. Hobbies are forgotten. He or she rather sulk instead. Nothing seems to make them as happy as before, taking no pleasure in spending time with family or playing their favorite sports. They are anxious, irritable, and guilty in feeling this way. If there are problems at home, it is bound to affect the adolescent. Why go home to a place that doesn't feel anything like it? They dread dealing with the people they live with, becoming so detached and careless. The symptoms are obvious to parents who pay enough attention to notice. Broken homes tend to create broken children. The people these young adults surround themselves with are also factors to depression. Being bullied, feeling out of place, knowing they do not belong are examples. When cliques are formed and they're the only ones out, where would they fit in? This social problem convinces he or she that they will never matter. Sometimes depression isn't caused by stress at all. If there is a family history of this disease, then chances are the kid would be depressed as well. It is inevitable when depression lies in the genes. Statistically speaking, people with a family history of depression may be more likely to develop it than those whose families do not have the illness. Of course, depression hits certain people differently. Some overcome this instead of others that have mild cases. These are the ones that contemplate suicide as a means to be free.
There are different types of treatments for depression. The first one is antidepressant tablets. They work by boosting one or more chemicals called neurotransmitters in the body system. They don't work right away. It takes roughly about 2 weeks for it to start to impact someone. They are not addictive, so a patient should not stop taking it because some mild unpleasant effects can occur if they are stopped suddenly. It should be taken regularly, so a patient shouldn't forget to take it. After a patient has recovered, the antidepressant should be taken at least 6 more months in order for it to reduce the chance of depression from coming back. There's also taking treatments like counseling, therapy sessions, and other types of psychotherapy. Psychotherapy is a general term for a way of treating depression by talking about your condition and related issues with a mental health provider. They are carried out by doctors, nurses, psychologists, and social workers. One of them is cognitive behavior therapy, or CBT. CBT is a psychological treatment which recognizes the person's way of thinking and acting that affect the way they feel and behave. A professional therapist identifies the patterns of thoughts and behaviors that are causing them to be depressed. The second one is electroconvulsive therapy, ECT. ECT is known as electroshock. It is a psychiatric treatment in which seizures are electrically induced in the patients for the symptoms to go away. They are very effective, and it's really effective for those with severe depression. It works more quickly than antidepressants. Also, family and friends can help a depressed one recover. They can offer support, understanding, and help. Exercise is a good way to prevent or manage mild or moderate depression and anxiety. Mood stabilizing medications are medications that are used to boost up the effects of antidepressants. The best mood stabilizer is lithium, also used in bipolar disorder. There's also hospitalization and residential treatment programs. When depression is so severe, hospital stay is required. It can keep a patient calm and safe until their mood improves.
Worn out faces, bright and early for their daily races, going nowhere, going nowhere. Their tears are filling up their glasses.
the world just doesn't have a place for me. But don't worry, I found a way out. A solution that can end all this pain. Well, this is it. Goodbye.
I find it kind of funny, I find it kind of sad. The dreams in which I'm dying are the best I've ever had. I find it hard to tell you, I find it hard to take. When people run in circles, it's a very, very